But who knows anymore in this down economy?
Oh, this down economy, this damned economy.
Have you ever noticed? Because we have old Independence Day coming up, which is, I think you and I have made that one of my favorite holidays.
Same,
dude. You know what's funny about that is
same.
I talk to a lot of people because, of course, you know, like I went to my dermatologist today, cancer-free, by the way.
Hey.
And just people in passing. Got any plans for the 4th? You know, small talk stuff. And I always say, you know, me and my buddy are setting off an absurd amount of fireworks. And I got a bunch of responses like, oh yeah, I used to love that and I'm just over it now. I don't know, even if, like, you know, because there's kids around and they all enjoy it. I don't know if it's just all adults. I think I'm still going to really enjoy setting off an absurd amount of fireworks
Even
once
if
a
it's
year.
just by yourself.
Yeah. That'd be pretty damn sad.
Yeah. But I'd still do it.
Yeah. Like you just live in a cul-de-sac and everybody in the cul-de-sac's at some block party somewhere else and you're just sitting there setting off snakes in your driveway.
Snakes?
Yeah, and you use your tears to put them out.
Just have those little snappers.
I was thinking too, like, when we always play those goofy songs, have you ever noticed, like, just how, I don't know, they're not goofy, they're just kind of, I don't know if they're just silly or
overly, like, proud to be an American.
That song in particular, like, imagine the dude singing that. Like, just think about the guy singing
He's
that.
passionate.
Yeah, but I mean, what he's
and a mullet.
Yes, okay.
Yeah.
His appearance, and he's kind of older too, right?
Yeah, a little
White
bit.
hair,
A little bit of. I was thinking salt and pepper.
What kind of shirt does he have on?
He's got on a plaid shirt with a collar.
Yeah. And are there sleeves on it or no?
Now he doesn't have sleeves.
Now he doesn't have
yeah,
sleeves.
I didn't know that was an option, but
Yeah.
now I see it without
Is he wearing
sleeves.
denim?
Denim, of course.
Shorts, right?
Yeah.
Cutoffs.
Yeah.
Okay.
Cut off denims.
With Timberlands.
Yeah. That's a hell of a look.
Tell me that's not. And I love the lyrics to that song. They're, I'm proud to be an American where at least I know I'm free. I love at least.
Yeah.
Like,
all the other shit, but at least I'm free.
It seems like
it's like kind of
somebody. It seems like somebody was in an argument with another person over whose country was better.
Yeah.
And they're like, well, I live in America. At least I know I'm free.
Exactly. Because they're like, I live in Cuba. We have free health care.
Yeah.
Like, oh, yeah?
And then later on, that guy was thinking, proud to be American. At least I know. Because why at least? Why at least? Why at least? That is such a weird
I never
term.
thought about it. It is almost like maybe not such a good song for being patriotic. It's like you're kind of saying that like there's a lot of stuff that sucks about America, but at least we're free.
Right. Yeah. Because it makes me, I don't know why, but anytime that song is being said, it reminds me of Rocky IV, but not of like any of the American stuff in Rocky IV. It reminds me of when Drago is coming out of, like, I love these arenas that just, he comes, like the whole ring.
Yep.
You know how much money that would cost to like have an elevator and a ring,
That
like
was
a
a
ring
cool
size
entrance,
elevator to bring him up.
Yeah.
And there's a gigantic poster of him. Like,
Yeah,
you know, and
like
they're just
stories.
singing the national anthem for Russia. And I was like, I mean, I don't know what they're saying in you know, whatever it is, but like I could just imagine people in the, well, at least I know I'm free.
Yeah. as a 3-story poster of Drago's being shown.
Yeah, that is cool, but at least I know I'm free.
At least.
At least it's such a weird, dumb phrase. I don't know why you get caught up on that.
I never thought about it.
Yeah, it's pretty funny, but yeah, I'm looking forward to that. It's gonna be quite the show.
It's always a good time.
Yeah. What do your neighbors say? Do they ever?
They love it.
You ever talk to them afterward? Yeah.
The guy across the street is the only one I really even know anymore. He also redhead, big red beard. And yeah, he every year he asks me, "Are you guys putting on your show?"
Yeah.
Yep.
I know they all get out and get their chairs ready and everything, and they'll throw a few like of those flowers on the ground.
Yeah.
And they're like, "All right,
It's more
take it over, boys."
watching us. Yeah.
Yeah, it's pretty funny because I
don't talk to him at all during the year, but it's around July 2nd or 3rd. We'll talk, and then I won't see Tom.
That's cool.
Yeah,
I mean,
it's a good relationship.
Yeah, some good unity. I always worry about the people who turn down that way. Like they turn down that road and they're like,
yeah, chaos.
Like what am I supposed to do here? Like,
go around.
Yeah, go around. No, there is no around.
Yeah.
Like,
I need to get to my house. I'm over there.
Yeah. And they just have to wait because there's like a 2-minute firework going off, and it's like, okay, well, I'm not gonna roll my Range Rover over that.
Like a bombing raid.
That's funny.
Hell yeah.
Well, so yeah, today we were going to go over, I think the next like 3 on these. We're gonna go over skills. We're kind of double dipping. We're using this our podcast is like a way to practice for our presentation at ATSA, because we're in our last presentation we focused a lot on content, and it was a lot of like a lot of conferences, like a lot of you're just kind of talking to them about whatever it is that you're doing and throwing up slides up there. And I mean, it was great. I think it went really well and we got really good feedback, but we didn't get to any of our demonstration of the skills that we've put together for this. So this go around, it's going to be flip-flop. And we'll acknowledge that at the beginning. Just say, hey, last time this is what happened. This time this is what we're doing, so they all know what they can expect. Because I would imagine that we'll have some repeat people coming back in for this one. So should be pretty good.
I'm sure.
Yeah. But yeah, so we'll be talking about this skill, countering or I don't know why I'd say countering countertransference. It's so silly, but confronting countertransference. So this is going to be in our clinical skills series. So yeah, what can you tell everybody about this? Because this is kind of a skill that, I don't know. It's not as if we found this in a manual, right?
Right.
It was more so you and I don't know if we were like.
This was like almost like retroactively we put the skill steps together based on how you and I deal with some clinically sticky situations.
Right. And it wasn't like organically like we were good at it. It took time for us to develop these skills, and then we would talk to each other. And I think this comes from, we know we can work effectively with this population, and then we ask ourselves, well, how do we do that?
What is it we're actually doing?
And then we put these together. So yeah, tell us about this.
All right. Well, with transference, we hear a lot about like, what do we do about it when we feel ourselves reacting to a client, bringing up our own stuff or whatever. And there's sort of like 2 directions.
And this is countertransference, right? Or transference?
Countertransference, the way that I'm feeling about the client.
Okay. And so
my reaction to the client.
So yeah, for anybody who doesn't know,
sorry. I'm just
if you're a clinician, or even, I don't know, like not even a clinician, like this is pretty psychology 101 type stuff. It is. They teach countertransference, but for people who don't know what that is, it's and countertransference is it always negative? Like it's like, or not? I don't think negative.
I think it's just like, I mean, it has a negative connotation because the idea is that I'm reacting to something about the client that's from my own personal whatever, and that if I'm not aware of it, it's going to impact the quality of treatment I deliver.
Okay.
And so you can have positive feelings. I had a client once that reminded me a lot of one of our mutual friends. And like he looked like him.
So fond feelings
of
that person.
Exactly.
But maintaining those fond feelings, particularly for a client that's like a justice involved client for whom you have to make decisions that could impact their freedoms. Like you don't want that fondness carrying. I mean,
it could impact my judgment.
Right. Okay. So it doesn't need to. I mean, I guess when people think about it, they probably assume that it's maybe I have a whatever's emotion is being triggered or whatever feeling is being brought up toward this individual. It's probably one that's fitting into a negative category, but not always.
Not always.
Just something that could if not checked or worked on, could adversely impact the therapeutic alliance. Yeah.
That's right.
Okay. So in this one, it's kind of on like with like any of our Dark Triad clients who have traits of psychopathy or like callousness towards others, or Machiavellianism, very manipulative, or narcissism. These issues of countertransference are kind of put on hyperdrive, right?
Definitely. We all learn, or at least it's suggested when we're going through schooling, to like, be aware of it and either control for it and don't let it bleed into your practice, or in some cases, and this is kind of what we'll be doing here, it's like a conscious use of self, like being aware of it and then dealing with it. But like Dark Triad clients, it's like, that we learn that about, confronting countertransference, but these guys can be exceptionally good at getting under your skin, and they don't have the same, I guess, governor over their social interactions. They don't necessarily treat other people the same. So sometimes some of the stuff they say can get under your skin a bit.
Well, yeah, and I would assume, like, if you're going to be working with that population, you probably prepare even more, right? And you're like pumped for it. Okay, you're expecting it. But then it's not as overt as you might expect it to be. And so like you think, oh, I got it nailed, but then they're, like you said, they're experts at getting under your skin. That's kind of a thing that they do, and I think in a lot of ways they do it very covertly.
Right.
And so you kind of get taken aback when it does happen, and if you're not prepared for when that happens, then it can really adversely impact the relationship. And kind of what we talked about as far as an introduction to this is we developed the skill. Well, and I don't know, kind of go through some of these for us so we kind of understand a little bit more about why would we even pay this any attention? Why do we even need this?
You bet. So if you're just listening, the first bullet point is the goal of confronting countertransference is to manage your internal reaction to remain an effective tool capable of delivering helpful feedback. So again, in the introduction, we're going to talk a lot about that. They're going to see us as a means to an end. We're not a three-dimensional human being. We're a tool that they're going to try to use to get through the criminal justice system. And the effectiveness of the tool is something that we can hurt or help throughout treatment. And a lot of times if you misstep, or if you're not aware of your countertransference and it comes bleeding out into a session, the client might clock you as a broken tool and placate you, tell you what you want to hear. You might never know you've been shifted into the category of broken tool. In fact, a lot of these guys are slick enough that you're not going to know. And so the idea is if you use this skill, that despite the internal reaction that you get from whatever the countertransference is, that you'll be able to think through things in a way that still allows you to be firmly planted in the effective tool category while addressing the thing that came up. That's the kind of the sorry.
Yeah, because for a lot of people who are working with it, the therapeutic relationship is brought up often as something that it is a prime driver in a client's positive outcomes, like in their success in treatment, right? But the therapeutic alliance with this client population, with Dark Triad clients, begins and ends with your effectiveness as a therapist to get them what they want. They're not really concerned with a meaningful relationship beyond self-interest for them.
Sure, right? Doesn't seem like it.
Well, right, yeah. And so I think
they'll make you feel that way, though.
Sure, and I think clinicians need to know that ahead of time. Like it's not, and kind of need to be okay with that if you're going to choose to work with this population, serve this population, because they are, in my opinion, a very underserved population, because you have kind of one of two categories of clinicians that work with them. You have clinicians that say, I don't want to work with any type of personality disorders, and Dark Triad is not necessarily a personality disorder, but they have traits of all these areas that are present enough that we know they're there. You know what I mean? Whether or not they fit the diagnostic category is not necessarily relevant. We have to address these features of their personality. And then the other camp of clinicians, I think, place them in the untreatable category.
Oh, yeah.
So they start working with them, and then their trajectory of progress doesn't match up with what the clinician's expectations are, and then they start thinking of them as untreatable.
Like, this guy doesn't think about anybody but himself. He's a complete jerk. I don't want to work with him. He's dangerous.
Right.
He's
Which
dangerous.
is all true, but I mean,
you still got to treat him.
Well, sure, yeah, and I've never. It's weird. I've never gotten to a situation where I'm giving up on this guy. Never. Like, it seems weird. Like you would just give up on a client. You know what I mean?
You're kind of wired the same way. That it's like a challenge for you.
Well, it is a challenge, but it's also like
untreatable. We'll see about that.
I mean, to what end? Like, so you give up. What does that do? Like, I give up. Like,
untreatable through conventional means, maybe. Like especially with old school therapy, to where there was such a premium on understanding and recognizing and reflecting victim impact, and empathy. Like, if that was still the hallmark for, like, effective treatment adherence, like that, then yeah, they're untreatable if that were the measure. And luckily we know that that's not, and there's a lot of other things we can look at to decide if someone's treatable. The lack of empathy that they demonstrate a lot of times is what would generate the countertransference that would be working at.
And I guess
confronting.
We focus a lot on outcomes, which we should focus on outcomes. But I guess if you can't get a level of comfort with rough around the edges outcomes, then you're not going to be successful with this population.
Right.
Like, your expectations just should be accurate, not low. I'm not saying set the bar low, because sometimes they can be very successful in their own way, but an accurate representation of this client's like outcome potential of what you're going to see in them. So
exactly.
Okay. Well, the second one here is your emotional reaction may reflect how others experience the client. Use it as valuable data. Tell us about that.
All right, so check this out. So, and this is in one of my earlier slides, but I bring up Dr. Bernstein and that Emotional Vampires book.
Yeah.
Sort of like, if you rewind the clock way back, that provided some of the inspiration for the direction that you and I took all this.
Yeah.
And he explained something in a cool way. You have to allow for drifting back in time to when the DSM-4 was a thing, and we still did like the 5 axes.
Oh, yeah.
One thing that always stood out to me, and this is where this skill comes into play, is like axis 1 disorders like depression and anxiety. The person afflicted by the disorder is the one affected. Mm-hmm. If you have depression, you're the one that suffers from it. Personality disorders, it's everybody around the afflicted that's affected. And so that includes you. Like, once the client enters the threshold of your office door, it's not like all their characterological disorder crap stops. They're bringing it right into session with you. They're dragging you into the muck with them. And if you can recognize that and be on top of it, what your reaction is a lot of times can be informative for what everybody else's reactions that happens to be in their lives. And we can then address things that will improve their relationships with all the people in their outside life that maybe aren't having that type of conversation with them. So we're using it as like it's a tool that we're using ourselves.
So in other words, like, you're a micro representation of how on a larger scale with other people in their lives, they're much more, and so the other people in their lives are also very likely to experience the same reactions that you're experiencing, and maybe even on a larger scale, like even more so, because they're not trained clinicians. They're not preparing, and they don't know what a personality disorder is or is not until they read a little bit about it. It's kind of funny. Have you ever? Well, I know you have, but it's like we don't see many breakthroughs in therapy, right? I mean, it's like
you see in movies.
Yeah, it's a slow burn. You know what I mean? It's not like, I don't know. It's kind of like watching water boil. At one point it just starts clicking and people start doing better, but there's rarely like that moment where there's just flood of insight and all this other stuff. But when it comes to personality disorders, particularly if you've worked with anybody with borderline personality disorder, and not the borderline personality disorder, the people around them. And you had given me a recommendation for a book. I think it was called Walking on Eggshells was the name of it, something like that. And anyway, I recommended that to a mutual friend of ours. Dude, they were like, I mean, rarely do I get like calls from people like, oh my God, I can't believe it. It was spot on. And it wasn't really like telling them anything they didn't know, you know. It was just like affirming and validating for them that when they were reading the description in there, like, oh yeah, this is the family member like this is who I have to deal with on a rate, you know what I mean?
Yeah.
And like and I think the reason why that is because it's almost like when you're happy that the doctor can find a diagnosis, because then it's like treatable, you know?
Right.
Unless it's something.
It's like, oh, this is what it, even if it's bad news,
right.
It's like, well, at least I've got like something to put my finger on now and fight against.
And it can be, I mean, some of this is like, I don't know. It's like you really have to shore up your expectations when you work with personality disorders. And a lot of people are like, yeah, it's not going to change. You know, it just is. And it's really more about you adapting and doing little things to kind of work around it. But it's not, don't think that that person's going to going to the way that they are. There's not going to
be a breakthrough.
So yeah. So no, that's good. And I think, so yeah. And that can help them.
Managing expectations.
Yeah. That can help them later on down the line, your client with the personality traits, you're going to help them adjust to that, because if they want those people in their lives, which again is all about self-interest. So I have these people that are meaningful in my life as a client, and I want them to maintain, you're going to be able to work with them on behavioral things they can do to maintain those things, right?
Yeah.
Like that's how it's going to
work.
Okay. Well, what about this third one? Focusing on the content can trigger reactivity and make you a broken tool. Shift to observing the process instead. Explain that a little bit.
Yeah, you bet. So often, when I'm finding myself reacting to a client, it's because of something they just got through saying. Not always, but oftentimes it's something they're describing, something from their own life, the way they view a certain situation. And that's the content of what's being discussed in session. It's the data. It's the what can actually be observed. And that a lot of times is what produces that's what creates that triggering response. Whereas with the process refers to like the interpersonal dynamic between you and the client. And so the idea here is that if somebody says something to you that really gets under your skin, if you confront that directly, or you don't get a hold of your emotions in the moment, again, you're going to be clocked as a broken tool. But if instead I'm like, okay, I'm recognizing that I'm feeling, that I'm reacting this way. I'm recognizing that I'm having these feelings. This is my own self-talk. What do I need to say or do, or how can I talk to my client about this and bring it up? So he's aware that me and maybe like other people have this reaction, but I need to figure out a way to do it that actually lands with them, so that they still see me as an ally, bringing something to their attention. And each and there's not like a set thing to say. Everybody has their own style. Everybody has their own relationship with their clients. And so what it is that you actually come up with is that's up to the individual, the individual therapist. Just the idea is recognize, okay, what is the best way, given that I'm feeling this way, what is the best way to impart this information that this particular client is going to get where I'm coming from.
Because that's in their self-interest. Again, it goes back so one thing for anybody working with these type of personality traits, the only thing you can count on is self-interest and status. Like they care about themselves a ton. Mm-hmm. So even though you may be rattled by the content, the actual words they're saying, and the meaning behind those words and whatever those symbolize, you're saying, well, I need to redirect that into, well, okay, great. Like, hey, so here's how I might be reacting to this, and here's how others are likely to react to that.
Yes.
How is that going to turn out bad for you? I mean, who cares about me? Like, I mean, I'm not asking you to feel bad for
That's
me.
exactly right. I'm not.
Right.
That's a good point. If I'm reacting to the content, I'm making it about me.
Right.
If I'm shifting towards like, all right, hey, you and I need to figure this out. When you say this, this is kind of the reaction people have.
Yeah.
Let's figure out a better way around that.
Right. And let's come up with other ways to say things that still kind of get your meaning across, but are not going to fracture relationships that you need in your life to move forward. Okay,
awesome.
Good. And then our last one here is stay effective by asking reflective, process-based questions. And we kind of got into this already. What am I reacting to? How can I shine a light on this issue in a way he'll accept?
Exactly.
And we're using like he. I mean, I assume there's some females that have these issues as well, but okay. So shifting from content to process. So this is kind of a deeper dive into what we just talked about. Like, how can we go from content to process focused? So yeah, could elaborate a little bit more on this based on these, like content focus. I might say to myself, he's selfish. He doesn't care about anyone but himself. And the process focus is, this reaction I'm experiencing is likely common. How can I effectively help him to see that acting selflessly is in his best interest? And I mean, we kind of highlighted and italicized acting selflessly, because he's not truly being selfless. He's just acting the part.
Good.
Right?
Right.
Like, so
yep, that's a good
now
point.
people hear that, clinicians in particular hear that, and they're all, well, aren't you just kind of teaching him to, if you're acting selflessly, aren't you teaching him to manipulate people? Like, how do you respond to that?
I'd say,
I say yes.
Yeah. Well, I mean, yeah. But like, I mean, honestly, but like, try not to focus so much on right and wrong, conventional morals, more on what's effective or ineffective. If we can get him, he's not going to care. You're not going to like say something that he's going to have that breakthrough and care all of a sudden. But if we can teach him how acting selflessly is going to better his relationship with his spouse or with coworkers or with friends, and he buys it because you sell it to him the right way, you address it the right way, then his relationships are going to be more effective. Get away from right and wrong, go to effective or ineffective.
So in other words, you're saying take the value judgments away from it.
There you
like,
go.
it's not good, it's not bad. The effective versus ineffective, and effective towards what? And I mean, his goal, this is kind of where it gets a little confusing for people, because I will tell clinicians, well, so even though they may have very antisocial thinking and antisocial attitudes, you have to generate a goal with them, a collaborative, like long-term goals with them that are pro-social. Now, they can be self-centered, which is fine. I mean, like, I think about,
I want my wife to cook for me more.
Sure.
Like that could be a very self-focused goal, right?
Sure. But the pro-social, the pro-social spin to that, I guess, is having a healthy relationship with my wife. Like, it would be difficult for anybody to argue with the latter, right? But saying, I want my wife to make me a sandwich whenever I want. It's like, okay, that's, now that's how he defines it, which again, it's like, okay, I got to get out of the content of what he's saying and turn this into a process. So, all right. Okay. So you want your wife to make you sandwiches. Great. Okay, great. I need to move away from that. Says, okay, well, what do I need to do to get that to happen? I mean, I assume wives and husbands make food and stuff for each other's spouses all the time. Like, that's just mutual reciprocity is what makes relationships kind of work.
And
right?
if you can get them to, like, what skills are you going to be teaching him that's going to better the relationship between him and his wife?
Right. So if that means focusing on what her needs are, what her likes are, and if that means, so she likes to go to musicals and she likes to go out to dinner. So it's like, all right, well, I will act selflessly by taking her out to a nice dinner and going and watching Wicked.
Now make me a sandwich.
Yeah. With the now again, it's like, okay, now look, but the thing is like, okay, you take the content out of it, and you say, I don't think that's, if your spouse enjoys musicals and going out to fancy dinners, and then you respond to that by saying, I know they like this, so I'm going to take them out for this, and then they reciprocate by making you a sandwich or whatever it is. I mean, I'm trying not to be sexist because I don't make you a sandwich. It's like super like
well,
it's
trying
a
to
meme
get that
nowadays.
countertransference going.
It's a meme nowadays, right? I'm just saying that's not antisocial. That's not like now. Yes, he or she might be thinking about that in that way. These are just hurdles I have to get over in order to get my needs met. Okay. I don't know if that's necessarily such a bad thing, because the effectiveness of him being in that relationship still works. But you want him to do it. It's like that. I can't remember that movie. It's like, I want you to want to do the dishes. Why would I want to do dishes? You know what I mean?
Yes.
It's like, no. If it means I'll do dishes in order to get this from you, well, then I'll do the dishes. You know what I mean?
This is shadow rule shit, man.
Yeah.
You know, like
exactly.
when you go over that slide, that's like exactly what we're talking about here. And what ends up happening in theory is his relationship with his wife improves. She starts to see that he's making an effort. Maybe maybe he sees the payoff when she reciprocates with, I mean, make me a sandwich, like you said, is sexist or whatever, but that also could be shorthand for that. You know, he experiences love when she does acts of service for him.
Sure. And you can have whatever opinion you want about that, but if the relationship is mutually beneficial and reciprocal, it's kind of hard to argue with those outcomes.
Right.
You know what I mean?
Effective.
So, right. Exactly. So, and then the other suggestion that you have here is content focus. And this is more, I have an affinity for him.
Yes.
Like, he's fun, seems like a good guy. His PO needs to back off. And the process focus is, what evidence do I need to ensure I'm not being manipulated? And he's as squared away as he seems.
Exactly. And I've been in this role as well. Again, I've had clients that I really get along with for whatever reason, and I'll catch myself sympathizing with them sometimes. And if I'm not careful, sometimes I'm not holding them to the same standard as clients that I maybe don't have that connection with.
Yeah.
And I have to be willing to consider that I might be getting hustled. Maybe not. That's what, if I catch myself thinking like the content focus, like he's a good chap. Then
he likes the Cowboys too.
Yeah, exactly.
Just like me.
Yeah, fellow Cowboys fan, eh? Yeah, exactly. And so it's more like, he may or may not be a great guy, but it's more that I need to check in with myself to see, like, all right, what are some independent ways that I could verify that he's actually doing good? What I need to put, actions, not words. And so again, whatever that answer is, I don't have it depends on the client, depends on you, depends on your relationship with your client.
Yeah.
But
yeah.
that's the self-check you would do to get around that.
So it's not just about noticing horrible stuff, because he could be manipulating you in a way that's very endearing and friendly.
He might have figured out, it's like, oh, Jeff likes jiu-jitsu, he likes the Cowboys.
Yeah. But then, so I'm a jiu-jitsu cowboy. But if you or he buys you some jiu-jitsu shorts that have cowboys on them.
This'll work.
But I mean, instead, like, I think that's more difficult to see, that you're being hoodwinked. Either way, though, even if you respond to them in a negative way and maybe sanction them in one way or another, or at least rupture the alliance you have with them because they said something that offended you, or you think they you like them or something like that, and so you don't pay attention to things you ought to pay attention to. Either way, in their mind, you were categorized as a broken tool.
There you go.
So
exactly.
so I have to be an effective tool. So, like, being their friend is not, well, you should be you should be friendly with your clients, but never friends with your clients anyway. So, I mean, the idea is, I'm treating you objectively, objectivity is huge when it comes to personality traits like this. Mm-hmm. But I'm still going to do it in a very civil way, in a very fair way as well. So,
right.
Okay. So this next one, these are the skill steps. So, and you can do this. And the best times to do this, I think, for people to understand, is don't have this card handy, if you're writing this down, if you're watching the 5 people who are watching our YouTube video right now, if you're watching this and you're writing these steps down, don't pull this out like in the midst of it. So my suggestion would be take like real life examples of the times when you have been rattled by what a client has said, and then bring that into supervision. And you can do this either in a group supervision therapy, or you can supervision session, or like an individual supervision session. So your supervisor can walk you through this. And yes, this does involve some role play. And the purpose of role play is, it is having you break down the skills and make them like so absurdly slow that you are making sure that you're not missing anything, and that you're doing it the correct way. This does not guarantee that the next time you do it, you're going to be an expert. Far from it. You won't be. In fact, you'll be more mindful about it, and you might even be worse off than you were. Yeah. But that whole... I love how people it always bugs me when it's like, well, if at first you don't succeed, try again. But then they're like, the definition of insanity. I'm like,
which one is it?
Well, so what? Yeah. Yes, do this over again and bring this back and have some. I think clinical humility is the most important trait a clinician can have, and being willing to say, oh yeah, that didn't go the way I wanted it to, or that definitely could have gone better, and then come back and say, well, did I miss a step? What could I have done better? How could I have done that better? And then role play that again, like come back and do it again. So you're just constantly improving over time. But like it's reps. I'm just doing reps of this, over and over and over again until I get better.
I think what you're saying will be critical to explain when we're doing the presentation, just to get out ahead of the people that are in their heads being like, well, this isn't how a session would actually go.
Right. Right.
Yeah. And that's, yeah. Like, for example, for these skill steps, these are all thinking skill steps. For this particular skill, there's no instructions on what to say to the client or interaction like that. And so when we do the role play, we'll see here in a sec though, but like you'll tee me up by, running through the scenario, but then these 3 skills will be me talking to myself to give the picture to everybody else what I'm considering for each of those 3 areas. It's going to go nothing like real life.
Well, right. And the reality is the reason why we do that is because, like you said, there isn't a set of like trying to come up with skill steps or phrases for everything that could come up in a group or an individual therapy session. We don't want that. What we do want you to do is be clear-headed when you respond to them. And that's what this is about. This is about promoting some of that professional poise and just keeping your composure before you respond to them, like whatever they're saying to you. That's what this is about. This is this internal check for you before you get to the next step. That's exactly what this is. So yeah, the skill steps, I don't think we read them, was internally acknowledge my emotional reaction. That's step 1 to the client. Step 2, consider how my emotional reaction influences my ability to remain an effective tool. And then step 3, shift focus from content to process before giving feedback.
Right.
Okay. So let's...
if I even give feedback right then and there.
So I won't spend too much time on these, but the good news for anybody who's looking at this, obviously, there's a lot of empirical support for each of these steps. It's not just, again, I think you and I stumbled onto these as just a matter of we knew these were effective. We went back. And then I said, well, I wonder if there's any support for these. And there is.
That's awesome. That's how good we are, bro.
Yeah. On step 1, this was an article in the Journal of Sexual Abuse, and it was titled, are the emotional responses of therapists working with sexual offenders influenced by the offender's characteristics? And this was authored by Marshall, and Kingston. And basically, in this one, they highlight common countertransference reactions such as disgust, contempt, anger toward manipulative or hostile sexual offenders. So, which, again, that kind of makes sense. Like, it's like, I think we have a negative reaction to some of the abhorrent behaviors that they've engaged in. Like, good for you. You have a conscience. Congratulations. Like,
they don't.
Right. But that's, those are common countertransference. And so it validates the need to not only identify, but also manage those feelings if you want to remain clinically effective. And then an article by Olver and Wong titled Therapeutic Responses to Psychopathic Offenders, Treatment and Management Considerations. And this was in the Journal of Psychiatry, Psychology, and Law. This emphasized therapists' self-awareness and emotional regulation when working with psychopathic clients, and then provides specific guidance for managing emotional reactions to manipulative, grandiose, or antagonistic behaviors. On the empirical support for step 2, considering how it affects our effectiveness, again, the Marshall and Marshall was a good support, and it showed how therapists' negative emotional responses to certain client traits can impair judgment and treatment outcomes. So it's not just like the treatment, but my judgment about them and maybe some prejudices I have about them moving forward. I might start to have a perspective on them that's not fair and objective towards them. And then the Olver and Wong one, emotional reactivity is identified as a clinical liability in high-risk settings. So if you can't remain, and again, it's a very normal human trait to have emotional reactivity, but not to the degree that it's going to affect the interaction you're having with them. Yeah. That's why this skill is in place, because it's not this is not a normal situation. Like, so this is the only time we give skill steps to clients is when there's a skill deficit. And so some of the skills we talk to clients about, like asking for permission or I don't know, dealing with criticism, you look at the skill steps and you're like, well, yeah, of course, but for them, they don't know that. They clearly don't do well with some of those things. And the only evidence I need is they're sitting in my office talking to me. Like that's the evidence I need that's true. But we're talking about very highly functional people in a clinical setting that have, however they've accomplished it, got to, a level of at least perhaps a master's degree in education, if not a doctoral degree in education, and have been able to maintain a lot of that composure through other settings. So, the proof is in the pudding there, but this is not a normal response even in that realm, which is why the skills exist.
Exactly. Right. They may be functional people that therapists are trying these things, but they're in such an unconventional situation with highly non-functional people that, it needs some help.
Exactly. And then empirical support for step 3, shifting from content to process. Our boy Prescott and Mauser, and is that Marquis Desaad?
Yeah, I think so.
Treating individuals with sexual behavior problems, a compassionate, strengths-based approach. And this emphasizes reframing feedback around the client's goals. For example, status, success, instead of reacting emotionally. So it strongly supports the use of process-focused feedback that is more likely to be heard and integrated. Polashchuk. Relapse prevention, offense process models, and the treatment of sexual offenders in the Journal of Professional Psychology, Research and Practice. Advocates for helping clients understand their offense process, not just confront behaviors, support shifting from reacting to what was said, content to exploring the why and how process. So good empirical support for
pretty. Dude, I'm impressed.
What we're doing.
Yeah, I like that you came up with that.
You're impressed with yourself.
I did really good there.
Okay, so now we'll do the role play and show you guys kind of what it's about. And as we're doing this, I'm going to post the skill steps up here as we're doing that. And when we do this in supervision, you would you would say it's a group supervision setting. You would have usually the supervisor be the therapist, and because the clinician bringing it up has much better knowledge base of the client, they're going to be the client. So they're going to say, hey, here's the situation that rattled me, and say, okay, if I'm the supervisor, say, okay, you be the client and I'm going to be the therapist. I'm going to be you, basically, right? And then you say whatever you did. And then the other members of the supervision, you're going to assign them to pay attention to what's going on, and you're going to make sure that all the steps are being followed. Once that's over, you switch. And so what you're doing as a supervisor there is you're modeling for them how to do this. Because if you just put a clinician on the spot as their supervisor and say, well, here's the steps, do it.
They're going to bomb it.
Well, yeah, they're not going to do well. They're not going to know how to do it. And they may say, no, I'm not going to do it. And they don't know how, like, the way that it's designed to do it, because it's a little weird, like, right when you're doing a role play, because you're like thinking out loud. It's like, you give a good description. It's like the Saved by the Bell description is my favorite description, because I always think about my boy AC Slater. So what is that description?
Well, if you remember, Zach Morris, probably almost every episode, something would be going on, and then he would call a timeout, and everybody on set would freeze, and then he would talk directly to the camera while everybody's frozen. And it became like a running gag throughout Saved by the Bell. And that's essentially what this is that once the actor in this situation, it'll be you. Once you have finished saying whatever the triggering event happens to be, it's essentially like everything freezes, because from there I'm going to be demonstrating what I'm actually thinking. I'm going to be going through the skills, and in no way is it meant to mirror how it would go in real life. It's to get the reps in dealing with whatever the situation is, and then taking the time to go through the steps in my head. So I guess just like anything that you would drill, any sport, any sport skill or whatever, you drill it at a slower, rate.
Well, right. You don't, like, if you're learning, you mentioned jujitsu earlier. Mm-hmm. If you're learning a jujitsu move, I assume in a lot of like manuals or even like, I don't know, like videos too, they sometimes will have a step-by-step. Here's what you do with pictures too. You don't then practice that in your next jujitsu tournament. Like, you practice that in practice, exactly, in drills. So yes, everybody, we know we're playing dress up here. We know, like, this isn't supposed to be accurate representation of real life. That's not what it's supposed to be. This is designed to give you an opportunity to practice the skill as it was intended to improve that. But so for those of you who don't know what Saved by the Bell is, because I assume some of you are maybe a little bit younger than 35 and older,
aren't gonna know.
It's like there's a dude, I always loved it when they did that, and everybody, like, they didn't have the technology that they have now, and everybody was just like required to stay as still as they could. But there's always that one person that was like
wavering.
Yeah. It's like, dude, that guy's broken, bro. He's glitching. Or you see somebody like breathing heavily, or they're like in a weird spot where they're stumbling. I wonder how many takes that took sometimes. But
I bet
it's almost like a record screech happening. Like,
there you go.
And then you get into.
That's for older people too, man. Do young people know what records are?
Yeah, I'm trying to just pause. It's a pause, and then we go into like so. What Jeff is going to demonstrate probably happens in a matter of 1.8 seconds, in your own head, because that's how quickly our thoughts go through. So we are slowing it down again to almost an absurd degree, so you can really get a rich process of the steps. So I have some additional dialogue on the steps, but you'll be going through the steps thinking out loud as we go. So I'll set the table for what's happening. So in a role play, we're going to give an example of a client, and this was my experience with this. That's why I'd be bringing it to Jeff's attention, and it was a client that we were in group therapy, and I was having them watch a video, which is always a risk, apparently. And it was just a clip of a video, and it was from a documentary called Deliver Us from Evil. And this was a kind of a deep dive into a single priest that had sexually abused a lot of his followers,
his parishioners.
Word? Sure, I don't. I should look that up.
Say it.
Yeah. I was gonna say priestess. That's not it. So
priesties.
Whoever follows priests. All right. And in one case, he actually was invited into the home of some of his parishioners, and it was a mother and a father and their daughter, and he was sexually abusing the daughter. And the daughter had been being sexually abused for years. She didn't tell her dad what was happening, and the reason she didn't tell her dad was because, and she's mentioning this in the documentary, the reason she didn't tell her dad was because she had asked one of her friends, like she was, I don't know, 5 or 6 at the time, and they don't know. Hey, what happens if somebody kills somebody else? And then her friend's like, oh, they go to prison forever, And the reason she asked that was because her dad had said, like a lot of dads do, is, hey, if anybody ever touches you, you tell me and I'll kill them. I don't know if exactly that's what he said. Anyway, so that's why she didn't say. And then this is way, she's an adult now. She's talking about this. Her dad's sitting right there. The camera's on them. Really emotional, powerful moment in the documentary, right? And then what I'm going to say is what the clients. So I stopped it, and it's kind of like, when you don't know what you're doing, and you're like, all right, what do you guys think? That was my question basically to them. Like, no guidance, no nothing. Just what do you, and we'll give the response that my client gave in that situation, and then you're going to be the therapist in that situation.
Yeah, and so like right as soon as you make the comment is when I'll jump into the skill steps.
Yeah, you are, and when we set this up, like,
right,
when we're doing the role play at ATSA, how it's going to be is as if we were doing a supervision session. You're going to say, well, hey, tell me what happened, and then I'm going to explain that to you, and then you're going to instruct me. All right, Mace, I want you to be the the client in this situation, and I'm going to be you in this situation, and I want you to say what you said, and then I'm going to go through the skill steps so you can see them, and once we get through that, then I want you to do what I did. We're going to switch places, and then you're going to do that, and we'll try to incorporate a couple audience members. They're not going to have to do anything. They're just going to have to watch
skill steps.
And of course, we'll give them a hand afterward. So, okay. But yeah, in this, you're going to,
I'll just say, yeah, tell me about the situation.
Tell me about the situation.
Yeah. You did. All right. So what I want to do is I want you to.
Oh no, we're past that.
You don't want me to try it right now for posterity.
You're going to be, well, yeah, we can. Yeah. So we'll do it as if, right?
Yeah.
Okay. All right.
Yeah.
And go.
All right. So, okay, I got to handle the situation now. So what I want to do is I want you to play the role of the client that you just explained to me and take me right up through the comment that got under your skin. And then from there, I want you to pause, and then I'm going to take over and perform the skill steps. I want you to observe how I'm thinking through and rationalizing the different steps to myself, so you can get an idea of what the therapist's response could be.
So can you give me a prompt? Can you just say, as if we just press pause on the video, and you say, okay, what are your guys' thoughts? And then I will say what he said.
Okay. Yep.
Sound like a plan?
Yeah, exactly. You ready?
Okay. I am ready, Chief.
Okay. So video thing. All right. And pause. Like, all right, group. What do you guys think? Yeah, Billy. What's your name gonna be? Scooter.
Yeah, Scooter's my alter. No, we're Chuckles.
Oh, Chuckles. Okay.
We got 3.
Chuckles. What?
We got Chuckles, Ray, and BMO. Those are our dudes.
So this is Chuckles. Then.
This is Chuckles.
All right. Hey, Chuckles. What do you think,
dude? That chick. She needs to. This is what I have to say about this whole thing. Cry me a river, build a bridge, and get over it, bitch.
And pause. Okay. Internally acknowledge my emotional reaction to the client. So I'm feeling contempt and anger and disgust at what he said, and these are natural countertransference reactions, especially when working with guys like this. So denying that I'm feeling contempt and disgust doesn't make it go away. It just increases the likelihood that that they'll leak into how we engage. And recognizing these emotions is pretty well the foundations of keeping ourselves grounded and clinically effective. So step 2 is I need to consider how my emotional reaction influences my ability to remain an effective tool. So, I mean, here's the thing is right now I'm pretty fired up. If I confront him right now and lay into him about this while I'm still pretty well emotionally activated is going to come out sideways. I might sound sarcastic, aggressive, judgmental. I am judgmental. I feel it right now, but that's gonna render me a broken tool if he picks up on that. So I gotta cool it for now, and wait until I can figure out a way to deliver feedback in a way that he can actually hear. And so let's see. Okay, shifting from content to process. So it's definitely the content of cry me a river, build a bridge, and get over it. That's obviously what rattled me. And so this might be a broader pattern for how he interacts. If I'm feeling this way, there's a really good chance that other people in his life are feeling this way, that he's had this same effect on other people. This guy likely drops comments like this, and as I know, it's with personality disorders, it's the people around the afflicted that are affected. Well, I'm affected, so I need to find a way to bring this up. So I think what I'm going to do is I'm going to sit on it for now, but during group therapy, during individual therapy, I'm going to maybe I'll ask him, hey, when you said that, what were you feeling at the time? And then also I might ask him, how do you think that you were perceived by others when you said that? How do you think you came off? And then based on how he responds, I'll be able to kind of take status and use that as a tool to help point out how others react.
And scene. Okay, good. So, and then now a common, so we're kind of we'll set the table ahead of time, because I think clinicians need to know, anybody who's using this skill, I don't know what you say. Mm-hmm. to them. If somebody asks you though, okay, well, what do you say to them right then in the group? Because you can't let that go unacknowledged. Like, what's your initial response to bridge it into the individual therapy?
Well, that's a tough one to answer. And like when I'm thinking about this, there's always a bit of a trade-off in that as we went through in the scenario, if I say something right here, I'm feeling pretty activated. I risk losing him through smashing him verbally. And so the trade-off is I'm going to wait until group and until individual to bring it up with them. And then once I've had a chance to process it with him in individual and get him to see how that could be a status lowering comment and that he's not coming off the way that he maybe wants to come off, then next group, again, because there's going to be people in group that are like, what the hell, Jeff? You're not going to say anything? You're just going to sit on it? You're going to let stuff like that fly? And other people in the group might even be thinking like, oh, shit, okay, well, whatever. That's what it is. I'm definitely going to address it. But that'll become the topic of conversation the next group that we have. We'll talk about, okay, here are some of the reactions. Here are some of what was said. What do you guys as a group think and feel about what each other said? And then the client, again, he might not like what his fellow group members have to say, but I'll have already prepped him. He's going to be able to see me as an ally that I kind of pulled him aside and said, hey, here's how that's perceived. And if anything, worst case scenario, it substantiates what I say when other members bring that up and allows me to keep credibility with the client remaining an effective tool.
But the goal for that would be, correct me if I'm wrong, to make him act in a way that other group members are going to see him as making progress as well. Mm-hmm. Like they're going to see, they're going to want to maintain a relationship with him, but they're all going to see him making progress. Because I think that this is playing with fire in a group type setting. Because if you start going over our shadow rule, do unto others as deemed useful unto you, which I'm proud of us that we came up with that. If you start reinforcing that, which is kind of what you have to do in a weird way, right? Or we go back to, well, yeah, just act selflessly so you can get your wife to make you a sandwich.
Yeah.
People are going to be like, dude, are you crazy? Are you like, you realize you're teaching him to manipulate better? Like, it's like, well, yeah, I mean, I am, manipulation.
Oh, yes.
It gets a bad kind of, I was like,
influence.
Sure. So what's a good way of saying manipulate? I mean, give me a synonym you're more comfortable with, and that's what we'll say. because we're leading towards a pro-social outcome. That's the difference. That is the big difference here. Is we're not leading to power differentials that result in abuse. We're leading to a pro-social outcome. And so
we might want to emphasize that multiple times.
We will. But that's why our presentation's called Breaking Bad, but not too bad.
Yeah, right.
Because it's not, we can't, yes, if other group members saw that without context and history in the raw, I think they'd be really uncomfortable with it, and they would it almost rupture your rapport with them as well at the time. I think you run into problems with that. So, because in that situation, that is really risky. And so moving it along and, just getting on to the next thing. Yeah, I think you're going to risk. So even if you just say something like, well, yeah, that's a really unique perspective. Other thoughts, I've
dropping at least some kind of comment to acknowledge it.
Yeah. You can't just not acknowledge it.
Like I didn't hear it.
Yeah. Like turn this into, okay, this is not the time for a whole lot of process stuff, right? We're not going to get into that. Like I just need to make a judgment
That's a good
call.
one.
Yeah. But that's the thing. I don't know what to do in this. So because this is the problem with this is people will say, and by the way, if you're in a conference and you do this, stop. Okay. Because when somebody's presenting on these things and they say, well, I got a guy, and then fill in the blank. Okay, look, not every technique is going to apply directly to your individual problem client. It's up to you to adapt some of these skills and troubleshoot to meet your client's needs.
Yes, this isn't a what to say.
Right. We're not, this is you getting it under control. Right. So essentially that whole skill was, and we'll preface this ahead of time is, I'm not trying to react. What I need to do is move this to individual therapy so I have time to gather my thoughts and not react emotionally in the moment. That's all I'm trying to do.
You know what I could say is that and that's the way that I would reason through it. And I could say it's very conceivable that one of you running through all three of these steps might come to a completely different conclusion based on the way you operate. And
which is
based
great.
On, yeah, great.
Totally
and so
great.
maybe you do address it right then and there. My thought process led me to talk to him an individual. Yours might be to address it right there. Apply the skills, remain an effective tool, and great.
Sure, and you might be skilled enough. You might be skilled enough to pull that off, like
That's
in a group setting. I don't know. This is just my thought process towards this. So
perfect.
Well, that's good.
Good.
So yeah, geez, this is a long episode, dude. Normally they've been 30. We're at an hour. It's time flies when you're doing whatever the hell we're doing.
Yeah, this is one skill out of 3. So that's 3 hours. So an hour per skill.
Yeah,
so we need a 3-hour presentation.
But we won't.
Half an hour up front.
We won't do that.
3.5 hours.
We've been really talking about it in a way for people to know more about it. So okay, well, that's enough of this. We'll let you guys know if we make it through the 4th of July. We'll let you guys know.
So with all our fingers.
Yeah. Until next time.